Brooke, my name's Emmy. I'm a student nurse practitioner. I understand you're here for your breast examination today.
Yes, I am.
Okay. Well, first we'll just start with some history.
Okay.
I'll ask you some questions. We'll go over any risk factors you may have for breast cancer. Okay.
Okay.
There is a tool. It's called the Gale model, and it assesses for your lifetime or 5-year risk for breast cancer, but it's not recommended for anyone under age 35, which you are, correct?
Yes, I'm 32.
Perfect. Okay. And what do you do for a living?
I am an account manager for an insurance office.
Okay, that's good. So your occupation does not put you at any increased risk. Have you ever found any lumps or masses on your breasts?
No, I have not.
Do you have any breast pain or nipple discharge that you've noticed?
No.
Good. Have you ever had cancer? Breast, ovarian, colon?
No.
All right. And how old were you when you first started your period?
8th grade, so 13, I think.
Okay, that's good. Sometimes if you start your period before age 12, that can put you at an increased risk, so you're okay there. And do you have any children, or have you ever been pregnant?
No.
Okay. And what medications are you currently on?
I'm taking BS for birth control.
Okay. And how long have you been on that?
About 6 months.
Okay, good. That's just important to know because sometimes increased estrogen in your system can increase your chance for breast cancer. And what kind of diet are you on? What do you typically eat?
I eat pretty healthy, mostly protein and a lot of veggies. And
Good.
Yeah.
That's great. And do you exercise?
Yes, about 3 times a week.
Great. And what about alcohol? Do you routinely drink that?
Yes, probably 2 times a week.
Okay. Well, that's not bad. The American Cancer Society says that eating a healthy diet, routinely exercising, and reducing your alcohol intake can decrease your chances of breast cancer. So you are on the right track.
Okay, great.
Okay. And I'll just ask you some questions about your family history. Do you have any first-degree relatives in your family that have ever been diagnosed with breast cancer, ovarian cancer, or colon cancer?
Yes, my mother was diagnosed at 49 for breast cancer, and I have an aunt that was diagnosed as well. I can't remember how old she was.
Okay.
But no colon or ovarian.
Good. So that may put you at a little bit of an increased risk. Do you know if they were tested for the BRCA gene?
Yes, my mother was tested, and it was negative.
Awesome. That's great. That lessens the chances for sure. Okay. And any other significant family history?
No.
All right. And let's talk a little bit about self-breast examination. Do you check your breasts at home?
Not as much as I should. No, I have before in the past, but not recently.
Okay. So that is important. It just helps you to be aware of your breasts and how they normally feel and look. So that way when there are changes, you can notice those changes and let your doctor know.
Okay.
That way breast cancer is detected sooner, and if you can get treatment going earlier, and it can be more successful if you detect it earlier.
Okay.
Okay. Typically the best time to check your breasts is 5 to 7 days after your period. You have less estrogen in your system then, and so your breasts aren't as tender and they're not as enlarged or have as many nodules. So 5 to 7 days after your period, doing it in the shower or in front of a mirror,
Okay.
it's a good place to do it.
Okay.
And whenever I do your breast exam, I'll kind of go over how to do that as well.
Okay.
Okay? Alrighty. So first I'm just going to inspect,
Okay.
and you can do this in front of the mirror as well, just arms by your side.
Okay.
And I'm looking for any asymmetry, any masses, any dimpling or retraction in your nipples. Looks symmetrical. I don't see any obvious masses or anything. Now I'm going to have you lift your arms above your head.
Okay.
Okay, and this is just helping me see any changes I otherwise couldn't see. They still seem symmetrical. That's good there. No retractions.
Okay.
And lastly, put your hands on your hips. Okay, and lean forward. Perfect. And this is just helping me get another view, make sure there's no retractions or dimpling, no masses.
Okay.
Okay, good, good. So now I'm just going to feel for your lymph nodes.
Okay.
First I'm just going to feel on your neck. But don't feel any bones. I'm going to go all the way down to your clavicles. Okay, and you also have lymph nodes under your armpit, axillary lymph nodes. I'm going to check for those as well.
Okay.
Apologize because it can be kind of ticklish. Okay, nothing there. I'm going to do this side. Okay, and then you also have lymph nodes here called your epitrochlear nerves. Lymph nodes, not nerves, that I'm going to look for. That feels good. And here. Good there as well.
Okay.
Next I'm going to do a bimanual examination. It just helps us to get another feel. So I'm just going to lift here, feel for any lumps or bumps. No masses. I'm going to do the same on this side. Okay, that's good. I'll have you lay down for me so we can do the breast exam. And I'll have you put your right arm over your head.
Okay.
Perfect. So I'm going to start up here in the armpit area. You have a triangle of tissue that we call the tail of Spence, and breast cancer is normally found in that area. So it's important to start all the way up here.
Okay.
And I like to do it in a vertical strip motion. And you use these first 3 fingers and go in little circles.
Okay.
So you want to start all the way up in that armpit area, work your way all the way down past the breast till you get the rib cage, and then go up in that vertical motion, kind of like a lawnmower. And you want to go all the way up to your collarbone. You have breast tissue that goes all the way up there.
Okay.
Just going all the way down. And you want to keep going until you hit that sternum bone. So you kind of make a big rectangle with it. So far it feels good. I don't feel anything abnormal. Okay, I'm going to do the same on the other side.
Okay.
You also want to check the nipples. Just slightly make sure there's no discharge. You want to look for scaling, tenderness, things like that, okay?
Okay.
Perfect. Starting up here, armpit. Making sure to go all the way back up to that collarbone. Okay, I'm checking this nipple. Okay, that looks good. You're welcome to sit back up.
Okay.
Do you have any questions for me or any concerns?
I don't think so. I have no problems, and you've been great, so thank you.
Great. All right. Well, we'll see you again in a year. And just be sure to do those breast self exams, okay?
I will. Okay.
All right. Nice to meet you.
Thank you, you too.